السلام عليكم دكتور. Good morning.
Good morning, how are you?
Fine. So, good morning, doctor. My name is Abdullah, and I'm a pharmacist, but currently I work as a medical representative.
Welcome, Abdullah. I am Dr. Abdullah too, and I am happy to be here in my office today.
That's great, thanks, doctor. So, how is everything, doctor, with you?
Everything's going alright, I just arrived. How about you?
Okay, I'm doing just great. You know that winter is coming after 1 month, and people will start to suffer from allergic issues like allergic rhinitis, and this will lead to some complications, especially sinus spikes and headache, which will affect their daily routine, like they won't do their daily jobs and schools.
Yes, you are absolutely right. The coming season, which is winter, will be very busy here at the hospital. It almost looks like I will be taking 10 breaks because of the overwhelming amount of appointments I have.
Okay, so what do you usually prescribe for these patients?
Usually we give patients with nasal congestion atropine, and patients with sinusitis we give them Nasonex.
Okay, well, you know that patients sometimes get addicted to atropine.
Yes, that's because when we give the patients the atropine, we advise them to take it for at most 3 days, but a lot of patients just depend on it and take it for maybe weeks or months, and they do not adhere to this regimen.
Okay, what about if they didn't adhere? If this is
In cases if the patient didn't adhere and has now been addicted, we give him just an oral corticosteroid like prednisolone.
Okay, that's great. Well, you know that you can also prescribe for them, besides the oral corticosteroid, you can prescribe for them also an nasal spray, which contains corticosteroid and antihistamine.
That's interesting.
Yeah, so basically, my company, the one I'm working for right now, which is Meda, I will tell you some information about it. It's concentrated in making medications for respiratory infections, like asthma and allergic rhinitis, and a top product in our lineup, which is Dymista.
That's interesting. I heard about this company a few months ago, and it's a very famous company.
Okay, so I will tell you how our product works. So it works effectively against allergic rhinitis, and it will reduce like the symptoms and complications of sinusitis and headache.
How exactly does it work?
So simply, it has 2 active ingredients. One of them, which is azinosine hydrochloride, which is a fast-acting antihistamine, and also fluticasone propionate. This is a corticosteroid that reduces inflammation, and it reduces inflammation and controls the inflammation related to the secondary complications like sinusitis and headache.
Okay, well that might be actually what I need for my patients, because a lot of patients come and complain from nasal congestion because they didn't adhere to our regimen for atropine. So can I actually ask what's the dose for this drug?
Yeah, it's simple. So basically, you have to spray 1 time each nostril twice a day, once in the morning and once in the evening, just for 2 months.
What about side effects?
So basically, for side effects, it has like aftertaste, nosebleed, skin rash, irritation in the nose, like inner skin of the nose. But all this are there just for the aftertaste. It's the most common one that the people suffer from, and in the beginning of the using of the nasal spray.
But the other side effects are not common, right?
Yeah, there are like 1 in 10 people that might have.
Yeah, so what about the price?
So for the price, I will tell you some benefits first before telling you the price. So basically, it improves the quality of life of the patient, and it also just you will spray it 1 time in each nostril, as I said. It has less systemic side effects, and that's for the
So that seems a little expensive, right?
Okay, I will tell you one more thing. It's just you mentioned about atropine, that people go and buy atropine like 1 time in 2 weeks, or 1 time in also 1 week. So
Yes.
basically they are buying atropine for 4 times a month. Okay? So our product is cost effective in this case because it will avoid the patient from buying 4 times Atrovine in a month. So it will cure the patient from nasal congestions, anxieties, and all of this pressure leading to headache. So
Yeah, that actually makes sense because instead of the patient buying Atrovine permanently, because of the nasal congestion will not get resolved because of it, this seems Atrovine reasonable.
yeah.
So is there any patient education information about this drug?
Yeah, that's a good question because the side effect that I mentioned, which is aftertaste, it can be reduced or avoided if the patient took the nasal spray while sitting down or standing up, and also spraying while tilting his or her head like a little bit forward, so to avoid or reduce the aftertaste. Because like you will feel the taste of the azilistine, which is the antihistamine. It's pretty hard.
Yes, after hearing all of that, I think you have cleared all of my concerns. So thank you, Abdullah.
Thank you, doctor. So I will just leave you for you some papers regarding the patient education and also the sample I did for you. And the papers contain the price of our product. If you would like, I need our number, I can give it to you. If not,
Does this contain the relevant information from the company?
yeah, from the company, if you need my number, it's fine, I can give it to you.
Okay, thank you, Dr. Okama.
Okay, thank you, doctor. Thank you. See you later. Thank you. So, doctor, I will introduce myself. My name is Abdullah, and I am a pharmacist, but now I work as a medical representative.
أنا جاهز دلوقتي ما عنديش داعي.
انت قلت ما عندك ضحك يمكن من 5 مرات 10 مرات.
So, doctor, my name is Abdullah, and I'm a pharmacist, but currently I am.